Fatty liver disease, characterized by the accumulation of fat in liver cells, is a growing health concern worldwide. This condition can range from mild steatosis to severe steatohepatitis or a non-alcoholic fatty liver disease NAFLD, potentially progressing to liver cirrhosis or liver cancer if left untreated. Understanding the causes of fatty liver disease is crucial for prevention, early detection, and effective management. This article delves into the primary causes, risk factors, and preventive measures associated with fatty liver disease. What is fatty liver disease? Fatty liver disease occurs when excessive fat builds up in liver cells, compromising liver function and potentially leading to inflammation and scarring. There are two main types: non-alcoholic fatty liver disease NAFLD. This condition develops in individuals who do not consume significant amounts of alcohol. NAFLD is often associated with obesity, insulin resistance, and metabolic syndrome. Alcoholic fatty liver disease AFLD. AFLD results from excessive alcohol consumption over time. It can progress from simple fatty liver steatosis to more severe conditions like alcoholic hepatitis and cirrhosis. Causes of fatty liver disease: non-alcoholic fatty liver disease NAFLD, insulin resistance and metabolic syndrome. Obesity, excess body weight, especially abdominal fat, increases the risk of NAFLD. Insulin resistance, reduced sensitivity to insulin can lead to elevated blood sugar levels and increased fat storage in the liver. High blood lipids, elevated levels of triglycerides and LDL cholesterol contribute to fat accumulation in the liver. Genetics and family history. Genetic factors can predispose individuals to NAFLD, influencing how fats are processed and stored in the liver. Type 2 diabetes. Diabetes is closely linked to insulin resistance and metabolic dysfunction, increasing the likelihood of developing NAFLD. Sedentary lifestyle. Lack of physical activity contributes to obesity and insulin resistance, further exacerbating the risk of NAFLD. Dietary factors. High-fat diet. Consuming large amounts of saturated fats and refined carbohydrates can contribute to fat accumulation in the liver. Fructose. Excessive intake of fructose found in sugary beverages and processed foods can promote fat deposition in the liver. Alcoholic fatty liver disease AFLD. Excessive alcohol consumption. AFLD develops when the liver metabolizes alcohol, leading to the accumulation of fat and inflammation. The risk of AFLD increases with heavy and prolonged alcohol consumption. Individual variability. Not everyone who consumes alcohol excessively develops AFLD, suggesting individual genetic and environmental factors play a role. Risk factors for fatty liver disease: obesity and overweight. Excess body weight, especially visceral fat, increases the risk of NAFLD. Metabolic syndrome. Presence of conditions like insulin resistance, high blood pressure, and abnormal cholesterol levels. Type 2 diabetes. Insulin resistance and elevated blood sugar levels contribute to fat accumulation in the liver. Age and gender. NAFLD tends to occur more frequently in middle-aged and older adults, and it is slightly more common in men than women. Ethnicity. Some ethnic groups, particularly Hispanic and South Asian populations, have a higher prevalence of NAFLD. Medications and other conditions. Certain medications, such as corticosteroids and tamoxifen, can contribute to fat accumulation in the liver. Other conditions like sleep apnea and polycystic ovary syndrome (PCOS) are associated with an increased risk of NAFLD. Diagnosis and management. Diagnosis of fatty liver disease typically involves a combination of medical history review, physical examination, blood tests, liver enzymes, lipid profile, glucose levels, imaging studies, ultrasound, CT scan, MRI, and sometimes liver biopsy for definitive diagnosis. Management and treatment. Lifestyle modifications. Weight loss through a balanced diet and regular exercise is the cornerstone of NAFLD management. This helps reduce fat accumulation in the liver and improves insulin sensitivity. Medications. Some medications may be prescribed to manage underlying conditions such as diabetes, high cholesterol, or to promote weight loss. Alcohol cessation. For AFLD, stopping alcohol consumption is crucial to prevent further liver damage and allow for potential recovery. Monitoring and follow-up. Regular monitoring of liver function tests and imaging studies helps assess disease progression and treatment effectiveness. Severe cases of fatty liver disease may require referral to a hepatologist for specialized care, including consideration for liver transplantation in advanced liver disease. Preventive measures. Healthy diet. Emphasize a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit intake of saturated fats, sugars, and refined carbohydrates. Regular physical activity. Aim for at least 150 minutes of moderate intensity aerobic activity per week, along with strength training exercises. Maintain a healthy weight. Achieve and maintain a healthy body weight through diet and exercise to reduce the risk of NAFLD. Limit alcohol consumption. If alcohol is consumed, do so in moderation according to recommended guidelines: no more than 1 drink per day for women and 2 drinks per day for men. Screening and early detection. Regular health checkups and screenings can help detect fatty liver disease early, allowing for timely intervention and management. Conclusion: fatty liver disease is a complex condition influenced by various factors, including lifestyle choices, genetics, and underlying health conditions. Understanding the causes and risk factors associated with fatty liver disease is crucial for prevention and early intervention. By adopting a healthy lifestyle, including balanced nutrition, regular physical activity, and avoiding excessive alcohol consumption, individuals can reduce their risk of developing fatty liver disease and improve overall liver health. Healthcare providers play a vital role in diagnosing, managing, and monitoring fatty liver disease, ensuring optimal outcomes and quality of life for affected individuals. Continued research and public awareness are essential to address the growing prevalence of this condition and its impact on global health.